Welcome to Every Mom is an Athlete, the podcast where we believe motherhood is inherently athletic. From lifting car seats to chasing toddlers, your daily life is a workout. I'm Dr. Carly, pregnancy and postpartum expert, sports chiropractor, strength coach, and mom of three. This is your space for strength, recovery, and real talk in pregnancy, postpartum, and motherhood. Welcome, Strong Moms. You're in the right place. Hello, Strong Moms, and welcome back to Every Mom is an Athlete. I'm really excited for this new series. So what we're going to do is we're going to have, I don't even know how many weeks, maybe 5, maybe 6 weeks talking about pains that I commonly hear in my practice that people have during pregnancy. And if you've listened to me like jump on this soapbox before, you know that pain during pregnancy is not normal, okay? So there's something that can be done. It's really common, but that doesn't mean it's normal. And so that's why I want to help people understand what they can do when they start dealing with some of these pains. So today, obviously, we're going to talk about sciatica. This is one of the things I just love helping people in my office when they come in, or I've even had a couple consults online where people are having this pain that's either like deep in the hip or going down the leg. So we're going to talk about what sciatica is to start and then what we can do about it. So true sciatica, well, okay, let's start with a little anatomy, okay? So you have a sciatic nerve on each side of your body, okay? So it comes out from the spinal cord, it goes down, like basically in your very, very low back, upper butt, it goes down through the glute, and then it goes down all the way through your hamstring to your calf, down to your foot. So all the way through the posterior side of your body, okay? And true sciatica is really an irritation of the nerve. Now, that can happen for a couple of different reasons. You could have a big old disc herniation in your back where basically a piece of the disc is like protruding out, and that's going to bump into that nerve root that goes into the sciatic nerve, and that's when you're going to get those sciatic symptoms. Now, in pregnancy, that is not really the reason I see sciatica. Pregnancy is a totally different beast. So during pregnancy, the reason that the sciatic nerve gets irritated is for a lot of reasons, right? One is hormonal. Okay, your pelvis is shifting and moving around and the ligaments are starting to loosen up, and that can cause additional strain or pressure or even pinching on that sciatic nerve. Another reason can be the shifting of your center of mass, right? So again, your pelvis is maybe tilting a little bit forward, so it's a little more anteriorly rotated as the belly gets bigger out front. That can be another reason. There's also some just asymmetry, right? So some people will have, even before pregnancy, if you've ever been to a chiropractor or PT and they're like, oh, one of your hips is rotated forward or your leg is a little bit longer or shorter, that can be from rotation in the pelvis. So some people have that. That just happens like, you sit a certain way and that causes it, or you sleep a certain way, or you like do something in the gym, or you slip a little bit and like shift that hip. That's really common. That's a really common reason to see a chiropractor and get that sort of alignment back in place. But during pregnancy, when that happens, again, it's like it just happens easier, right? Because everything's moving so much. But then again, it can sort of clamp down on that nerve that's running through the pelvis and through those glute muscles. Now, I'm not trying to scare you or anything like that. Again, I see this so commonly in my practice, and often it's a combination of these things, right? It's a combination of potentially not having the strength in your core that you need, a shift in the pelvis or a rotation of the pelvis and that change in anatomy, and the hormonal changes. So it all goes together. So how that presents often can be like deep pain in the glute, like deep pain that you like feel like, I can't really get to. It can also be radiation down the leg. So it can be tingling, numbness, just pain. And it can be additional pain on like one side, particularly with going upstairs, with walking, with rolling over in bed, and especially like standing on one leg or doing anything on one leg. So a lot of pregnancy, quote unquote, sciatica isn't really about the nerve, if that makes sense. And that's good news, right? That means like nerves are harder to heal. It's just more about irritation in the pelvis, and that can also involve the nerve. So hopefully that makes sense. So what do we do about it? Most important question, right? So a lot of people that come into my office with sciatica, they always want to stretch. They want to stretch the hamstring. And that can be helpful, right? But like if that was going to help, it probably would have already helped. So usually what they're feeling or what they can be feeling is this tightness in the hamstring, and it's really the sciatic nerve. And so they're stretching the hamstring, and it's just not getting better. Sometimes that even makes it worse. So I'll put a link below. What I prefer people to do is actually do a sciatic nerve flossing, and that can be really helpful to like glide the nerve through that hamstring instead of just stretching it. The other thing we don't want to do is, just in case there is some irritation up at the disc in your actual low back, we want to make sure that we're not like rounding that back when we're stretching. So if you're going to stretch your hamstrings, just make sure you keep your low back really flat and you really focus on the hamstring. I usually have patients put their leg up on a table or a chair or a bench or whatever to stretch their hamstring, and that way they can get a good stretch and keep their back flat while they do it. The most important thing, I think, during pregnancy when you're having sciatica is to make sure that your pelvis is in alignment. And so, number one, if you can get in to see a Webster certified chiropractor, I always recommend starting there. The Webster technique is something that a lot of midwives, OBs refer to during pregnancy. They refer to chiropractors who do that specific technique, mainly because it's a really gentle technique. It really looks at the pelvis and makes sure that both hips are moving equally and that one isn't like really rotated forward. And what this does is it helps your pelvis feel much better, right? Because one side, imagine if one hip is really rotated forward, that other side could be really pulling through your glute. One side might be pulling through the front. It just like everything is rotated, right? But then also, if your pelvis is rotated like that, it can be hard for the baby to get into a good position. So by keeping that pelvis nice and neutral and both sides working together well, the baby can get into a nice head down position and they don't get in kind of like that oblique, like kind of twisted up position where just because they really don't have enough physical room. So that's where I always recommend starting. Now, if you can't do that, that's one of the reasons I developed my whole pelvic pain fix plan, because it shows you in there how to align your hips at home. You have to have a partner to help you do it, but it's like really straightforward. And I have heard from people that have used the plan that it is the only way they got through pregnancy when they're having pelvic pain and like they either can't get into a chiropractor or there's not someone near them that does Webster. That can be super helpful. So just getting the pelvis aligned is the number one thing. The next thing I want people to do is look at their core, because if you are not supporting your trunk, right, then it's going to make it easier for things to happen away from the body, right? And this happens anytime. This is like all the time in life, right? If you're not strong in your core, then you're not going to be able to stabilize a shoulder, a hip, an ankle. Like you have to have that center strength, but even more during pregnancy. And this is like where it's a little tricky, right? Because pregnant women hear like that they can't do crunches and they can't do core work. And that's absolutely not true. You can for sure do core work. You should be doing core work. It just needs to be pregnancy safe and supported. Okay, the point of this was not for me to talk about all my plans, but I also have a pregnancy core plan, and that is why I developed that one, right? Because I truly believe that in my third pregnancy, the reason I had an easier labor, a better birth, a better postpartum recovery when I was almost 40 years old is because even though I like had little time to work out during my pregnancy, I really focused on core work. And so that helped eliminate back pain, that helped keep everything strong, just everything was better. It sounds like the fix all, but really, it truly kind of is. So anyways, where do we start with that stuff? So you want to be doing some transverse abdominal engagement. That's that big flat muscle. It wraps around your whole core. You hear a lot about this. You see women on social media doing like these belly pumps, where they have this big belly and then it looks like they like kind of like suck it in almost. They're using their transverse abdominis to do that, to pull the baby in. And so that's one muscle you really want to focus on. You want to make sure that you are breathing properly, because during pregnancy, obviously, if you're pregnant, that diaphragm gets so crammed up in there. And so it's hard to get a deep breath sometimes. And so when you think about the core, the diaphragm is the top. Okay, the pelvic floor is the bottom, the diaphragm is the top, and then you have all these muscles wrapping around, right? So you want to make sure that you're really focusing on those nice big kind of 360 breaths all the way around. That can actually eliminate a lot of back pain too, just by engaging those proper breathing muscles. The other thing I usually recommend when people are having some sort of sciatic pain is that you eliminate for the time being a lot of single-sided work. So if you're working out, maybe that's lunges, maybe it's single leg deadlifts or step ups, just that having all the body weight on one side of the pelvis can be a little bit hard until you kind of get through that. And for some women, it's no problem through pregnancy. They can do that stuff all the way through. But if you're having sciatic pains, that's one of the things that might help, is making sure that you're not totally loading, an increased body weight on one side of the pelvis. The other thing that I always recommend women try is some foam rolling. So if you have a foam roller, what you're going to do is you're going to sit on that foam roller. You're going to do a figure 4 with your legs. So let's say I have like sciatic symptoms on my right side. I'm going to cross my right foot over. So it's in like a figure 4. So it's like on my left knee. And then I'm going to sit on that roller and I'm going to rotate my body weight a little bit to that right side. And what that's going to do is open up that right side hip and the piriformis, which is the muscle that sometimes the sciatic nerve goes under it, sometimes it goes through it, but it's like right on top of there. It will kind of loosen up that muscle. And so if that is pinching and pulling, that can often alleviate some of the symptoms too. So that's one thing I always have people try, because if that fixes it, then great, there you are. That's your fix, right? And I always would recommend doing that over stretching, just because, again, remember, your ligaments, your tendons, everything is like stretching and moving so much easier. And so you don't want to pull on these tendons and ligaments that can pull into the pelvis and then cause other problems. So foam rolling is going to be a little more specific. It gets specifically to that spot, to the spot that might be tight, and then it doesn't mess with, all the other spots that are doing just fine. Okay, so when you need extra help, when, let's say you've tried all this stuff and you're like, oh my gosh, it's still bad. That's for sure when you need to talk to your OB. You need to get in to see someone. If the pain is getting worse through your pregnancy, if you're getting numbness, tingling, weakness in your foot, like if you can't pick your foot up, those are definite reasons to talk to your doctor, because you could have something more serious going on, right? If your pain is really limiting your sleep or being able to walk, that's another reason to get in to see someone. Either your OB, they can make a referral. You can get in to see, like I said, a Webster certified chiropractor. You don't, in most places, need a referral for that. And I do, in this case, recommend starting with a chiropractor instead of a physical therapist, just because they can really mobilize your pelvis in the way that it needs to be moved. So bottom line, sciatica in pregnancy, super common. That doesn't mean it's normal, okay? So don't just accept it. Don't just, I've got sciatica, I've got to deal with it. No, there's so much you can do. There's so many things that you can make improvements so that you can enjoy your pregnancy and not be in constant pain. If you want guided at-home support, you can find my pelvic pain fix plan in the show notes. And I actually think if you go to buy the pelvic pain fix or the Prego Core, you get like a deal on the other one at a discounted rate. So if you're interested in both of those, that should pop up on there. If it doesn't, reach out, because it should. All right, strong moms. So next week, we are going to talk about pubic symphysis pain, or SPD, as you might know it, symphysis pubic dysfunction. This is also really common during pregnancy. But again, there's so much you can do to help make it better. All right, strong moms, till next time. Thanks for listening. Every Mom is an Athlete isn't just a podcast. It's a reminder that you're still the athlete you've always been. If this episode resonated with you, I'd so appreciate it if you'd share with a friend or leave a quick review. It helps more moms find the support and information they need. See you next time.